Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today I am diving into that big news coming out of Walgreens with one of the companies that it has made a significant investment in, not VillageMD. We'll talk to them later, but we are talking to the CEO of CareCentrix, John Driscoll, about Walgreens' investment, the majority investment into his company, $300 million for a 55% stake of the company, $800 million valuation. John, congratulations on this. Cannot wait to get the details.
I am super excited to be here, but let me tell you, this is more about a much bigger story for CareCentrix than for Walgreens. Walgreens is this massive parent making a foundational investment in Post-Acute, but we are absolutely thrilled. I mean, it's a real validation of everything that's happened in the last few years in Post-Acute, and particularly at CareCentrix. It's exciting that they've made a big pivot into an investment and commitment to healthcare. Now we're thrilled. I'm psyched to get into it with you.
Oh my God, I can't wait. I have so many questions and I was collecting them last week at HLTH too. So this is going to be great. We're going to dive into all of the details. Before we do that though, I hate to assume that everybody knows everything about every company. So just introduce us really quickly to CareCentrix so we can get into the details about it as we continue to talk and unpack the deal. But introduce us to CareCentrix, talk about what you guys do.
Well, Jessica, thanks for giving us the platform. CareCentrix is the leading independent provider of post-acute services to health plans and risk-taking doctors and hospitals. Okay. We manage benefits like home health, home infusion, outside of the pharmacy benefit, as well as home DME. And we have a services platform where we actually manage chronic, complex patients with chronic needs across the home health and nursing home and palliative care continuum. We actually take all-cause readmission risk for 90 days from SNFs and hospitals. We really have a benefit management business that serves health plans and a care traffic control business that actually helps patients heal and age at home. And that's sort of our mission, is to really make sure that no patient spends any more time in an institution than they absolutely have to. And today we serve health plans, but we're increasingly starting to sign up some hospitals and risk-taking doctors as well, because as we move to value-based care, making sure more care happens at home in the community is so much more part of what's going to be part, hopefully, of everyone's future in healthcare.
All right, well, the investment from Walgreens is definitely an indication that you guys are doing something right and that that health is moving increasingly toward the home. So what can you tell us about this Walgreens Health strategy from your vantage point? I mean, obviously we know that the primary care side of things have been unfolding with the VillageMD investments from previously and then them, going in for more. But like, as far as adding your business into the mix and bringing in the post-acute care market, the health at home market, like what is this? What can you tell us about the Walgreens Health strategy and how they're looking at this full extension of healthcare services?
Well, let me start by saying, we're thrilled, and I can very much speak for CareCentrix, not for Walgreens. But as an observer, look, Walgreens has made a big commitment to digital health. That was they're very deliberate in their strategy. They made a big investment in one of the leading value-based managers of primary and specialty care, Village. And I think that the next logical step is post-acute. If you think about that transition of how they will leverage their primary franchise, which is the retail drug franchise, 9,000 locations, largest retail drug company in the United States, one of the biggest companies in the world, to start making foundational investments in where healthcare is going. If you think about digital, what Village is doing in primary care and what we're doing in post-acute care, that's where the puck is going in healthcare. It's all about lowering costs and improving outcomes, leveraging digital assets, leveraging doctors and retail pharmacists, and our nurses and our home health network in the field. I mean, I just think it's Walgreens not just investing in healthcare assets, but healthcare assets that are all going to grow and be materially important in our new value-based, healthcare system.
All right, I want to come back to that side of things, but before I do, I've got to ask you the question that everybody was kind of chattering about with this double deal, right? Because the news dropped on the same day, and everybody, was looking at, okay, VillageMD, now Walgreens owns 63% of it. CareCentrix, they own 55% of you. why not an outright acquisition? It's not like they don't have the money. So like,
No, I mean,
tell us
well, again, and speaking from the
from the CareCentrix side.
from the CareCentrix side, I think that what is impressive about their new CEO, Roz Brewer, their big investor, Stefano Pacino, all the folks we've been exposed to, Mark, the Walgreens team, they consciously want to get it right. And by making a deliberate stair-step set of investments where we are kind of dating and engaged, and then we get married in the end, it's a more natural progression for what otherwise might be looked at as an unnatural act, where you take the best performing pharmacy retailer to pivot into healthcare. They are very deliberately working with models that they know are going to scale and work with people they trust as they build that out, and they're going to make I think more investments and invest more in both of us to make sure that we can grow to maximum scale. But I just think it's a deliberate strategy to learn while we grow.
That's unusual for like a big healthcare organization. So it's like we had to ask. Thank you for giving us an answer on that.
I hope I'm right, but I will tell you that they couldn't be more thoughtful about how they think strategically and deliberate. But these are foundational investments, Jessica, in new models. And that's what's exciting, is you're also seeing them move very quickly to models that can truly transform care. I mean, we can dramatically reduce the amount of days people spend in hospitals and nursing homes. Village can dramatically lower the cost and improve outcomes in what they manage. You think about what that's going to mean in a healthcare system that needs to be on a budget, and frankly, costs too much and does too little. I mean, just in our post-acute area, it's $75 billion of opportunity, and it's unmanaged. And so I think that these are really big moves for a company that could really, if they continue to invest, really help kind of transform that arc of healthcare.
In that arc of healthcare, have you been exposed yet to the VillageMD people? Do you have any idea how you guys are going to be integrated with them through Walgreens?
I think they've been very careful not to use the word integration, but we're definitely going to coordinate and work with them. It's a natural, Jessica. Today, we work with doctors to help coordinate. Post-acute is what happens to you when you leave the hospital. Mm-hmm. And so when you think about who we're actually, when we think about our role as kind of care traffic control, working through our systems, our homebridge system, we are often taking information and feeding information back to doctors and doctors' offices so that the patients get the right care at the right price when they need it. And they're surprised and delighted when it works well. We're there when it doesn't work well. And we are naturally coordinating with hospital discharge folks, as well as primary care docs. And in some cases, actually won a very large regional blue recently. And one of the things they wanted to talk to were the doctors that weren't employed by us, but that we coordinated with. What's exciting about the Village transaction is you could see a future where we will be sort of seamlessly working with patients that they're already managing and helping make sure that nothing goes wrong after they leave the doctor's office or leave the hospital. There's just so much more we can do around the home. And I think that Village, because they take risk and are working with complex Medicare and Medicaid patients, there's a ton of opportunity. But as of right now, it's sort of in a kind of TBD future state.
Sure, of course. So, okay, let's talk about what we do know, because you guys have some great outcomes at CareCentrix. And so I want to actually talk more about that $75 billion opportunity here in the post-acute care space. You guys have phenomenal results, like reduction in cost of care for patients is like 20%. And one of the things that I even saw in this press release about the Walgreens investment was the fact that you guys can help them kind of bridge the relationship with payers in a different way. What can you tell us, John, about this side of it, about your business model and how this is going to be a real asset moving forward?
Well, I think that what's exciting for the health plans, because I've spoken to all my clients and a number of my prospects, is the opportunity to actually leverage all of that potential for local care that the pharmacies represent. A typical patient will visit a pharmacy 4 4 to 8 or 12 times a year. Now, you rarely go to see your doctor that frequently. A pharmacist is probably the most respected, least considered part of the healthcare ecosystem. And then when you think about what we can do, Walgreens has historically, I would imagine, most of their relationships are on the pharmacy side because that's what they do. Sure. Where we are relevant to the leaders of Medicare and Medicaid, the parts of the health plans that are focused on dual eligibles. We are in the payment flow because we're actually managing the benefit for home health, home DME, and home infusion. So we're in the cash part of the benefit and sort of the general contractor from a risk perspective around managing SNF and home health and readmissions. And so we're actually touching health plan leadership at many different places. And in some cases, we are well upstream of where the cash and the risk is actually being managed. That I think I think we can help the Walgreens actually find better ways to connect to all of the other places where pharmacy and pharmacy services can be relevant to Walgreens, but also from a health plan perspective, be that connective bridge and say, how about we consider leveraging pharmacies, not Walgreens and others, frankly, because we'll be working with many other pharmacies as well. We're not going to be exclusive. How can we actually engage pharmacies as more of a local health distribution service and support center? That we're very excited about what we can do telephonically, what we can do at the point of discharge. And you're right, we've been fortunate enough to have some great outcomes. Avalier did a study last year. And even though we just manage home health, DME, home infusion, readmissions, and palliative, they found that the all-cause reduction in costs, even after we stopped managing the patient, was 20%, because when you get patients on a better course of care, you get them on the right prescriptions, they understand and are connected to the right doctors, they understand how to access the right parts of the healthcare system, and they're sort of back. You've sort of made those orthopedic changes in their care and how they access care. The benefit of that, the lift from a health outcomes and the reduction in health costs is really dramatic. That makes us relevant to health plans at every level. And I think we can help kind of bridge that as Walgreens wants to play a bigger role at reducing costs and improving outcomes in healthcare in general.
I love that. And I think that we all knew that there was a tremendous amount of cost saving and an improvement in outcomes in, care that's delivered in the home, especially post-acute. But talk more about that. I think that the light started to shine on home health as a result of COVID. And I'm curious to know where you think the market is headed now. When we talk about home care, I feel like the definition of that has even changed from, end of 2019 to where we are today in 2021. But from your perspective, as somebody who's been in this business, tell us what you're seeing. How has the post-acute care market evolved through COVID? And what are these opportunities to really make an impact now as home care gets a little bit more, I guess, accepted by incumbents to make an impact on the cost of care and also on outcomes? John, tell us the beautiful vision of the future.
Well, it's not just a vision of the future, it's happening now.
Reality.
We're just in the early stage. COVID has shined a very bright light on why no one should spend any more time in a hospital, a nursing home, or an ER than they absolutely need to. Acute care has its place, but it needs to be shrunk. And because people understood the real risk, infection risk of being at one of those facilities, it's shown a light on what I think of as care at home. And you're going to see that we're just this is a tectonic shift where the plates have moved. The consumers are going to demand it. The payers are going to expect more care at home. And you're starting to see SNF at home models start to explode. You saw Amedisys bought Contessa, a wonderful hospital at home company. We're doing SNF at home as our nursing home care at home as are others. You're seeing Ready Responders and Dispatch, all these little companies start to emerge. For us, it's great because we're sort of the general contractors. We take the risk, manage the patient, and can coordinate them back into the rest of the system. And there's going to be more services that we can provide. About a little over a year ago, we bought a palliative care company because it was a natural extension, community-based palliative care of what could happen. But what COVID did is it reset the expectations of patients and plans that they are open to more alternatives for care in the home. And you see it in telemedicine, remote patient monitoring, and both patients and plans are going to demand it. And the good news from a CareCentrix perspective is this is sort of what we expected to happen in the future, but the future's coming at us a lot faster than we expected.
That's awesome. Well, now you are well capitalized to grow, which is awesome for you guys. All right. So tell me this about retail health, because this is the other thing too. It feels like retail health has taken a bigger step into healthcare than it ever has before. And I mean, truly, like even now with this, I mean, we saw the primary care deals like over the last couple of years, but this post-acute care deal, like, do you have any concerns heading into the retail health world and bringing post-acute into that space?
No, I think it's a natural connection. I think if you look at health, think of the way healthcare people access healthcare. The average person, leaves the hospital with 4 to 6 scripts. It could be bent metal. It could be a walker. It could be for a physical therapy. It could be, home health, and usually some form of, prescription medicine. None of that's coordinated. All of it is sort of people are dropped into behind enemy lines in healthcare, trying to navigate their way home. Our job at CareCentrix is to help people navigate through that jungle in a clear path, in a clear way. Retail is part of the system already. It's just more disjointed. But I will say that healthcare could benefit from a lot more of a retail focus, a focus on the consumer, a focus on convenience, a focus on lowering costs. If you think about the kind of opportunities that Walgreens, Walmart, and CVS can bring, it's really a consumer-centric focus. And then if they make the right investments and alignments and allies like with CareCentrix and Village and others, I think you're going to see a natural merger and new models will be created. I mean, the average person, again, visits the pharmacy a lot more frequently than they visit their doctor's office. How can we make that visit get a little bit more healthcare information or support, or put a little bit more monitoring there? Village has got great outcomes co-locating their doctors in the stores. I think what we're going to do at CareCentrix is add a network of home healthcare agencies, providers, telephonic nurses, and folks who are in the community helping kind of do that, working through that community-based coordination and recoordination, married up with retail, with a philosophy that the consumer or the patient comes first. I think that's a system that most people would want to sign up for. It's one of the reasons why people really like their pharmacists, even though they don't like a lot of the things that happen to them in the healthcare system.
I love this. This deal is like the ultimate expression of, all healthcare is local, right? I mean, it's like right down to the corner pharmacy. I love it.
Exactly. Well, healthcare
and into the home.
Yeah,
What's
exactly.
more local than that?
Why shouldn't you get healthcare where it's safest, where you're most comfortable, and you've probably got a much lower infection risk? I mean, it's just logical. We should be delivering more care to the home. And I think you're going to see, not just from CareCentrix and Walgreens, but that this is going to be a massive growth market for the next 20 years.
I feel like I think that you're absolutely onto something. And I think this deal is definitely like a signal that the market is definitely headed in that direction. So thank you so much for dropping by and talking through all of the details behind it. It's nice to hear more about CareCentrix because, like I said, I'm not sure if everybody was as familiar because,
they should be.
They should be, and now they are. And so but no, it's like, I feel like post-acute and home health doesn't have the same kind of visibility as primary care. And I'm right about that.
Oh, we are long form sexy cool.
Yes.
You watch.
Hey, I am right there for it. I am right there for it. All right, John, you're going to have to come back and talk to me. We'll get into like some deep healthcare stuff about yes, seriously, we definitely need to. Thank you so much for dropping by though and giving us the details behind this one. I totally appreciate it.
Delighted. Thanks for having us.
All right, John Driscoll, the CEO of CareCentrix, here to talk about all the exciting things as, what was it? Long-term sexy cool post-acute care makes its way into retail health. Fantastic. I'm Jessica DeMassa with WTF Health. For more interviews with the influencers and the who's who of health tech as they're changing the way that we do healthcare, check out my YouTube channel over there at youtube.com/WTF Health. Thanks so much for joining us. John, thank you again and congratulations.
Thank you, Matt. Thanks so much. Bye.
Bye.